Hi, I'm Kitsap County Commissioner Rob Gelder, and welcome to this episode of Commissioner's Corner. Today we will be taking a tour of the Port Campbell-Sklallam Tribe's Community Health Center, and we'll have a great conversation with Jolene Sullivan, who's the Health Services Director. Please stay tuned and you'll learn a lot. Well, welcome to this episode of Commissioner's Corner, and joining me now is Jolene Sullivan, who is the Health Services Director for the Port Campbell-Sklallam Community Health Center. So Jolene, thank you so much for taking the time out of your busy schedule to be part of the program today.
Thank you for being here.
So we are in a brand new community health center, and I think when I had a tour a little while ago, I was so inspired by the story of how it all began, right? And I think it's sort of, if you could share with our viewers, what were the goals behind the design of the building?
Sure. I think we had a lot of goals with the building. I think first was just we wanted it to be welcoming. Health and dental care and behavioral health services can be quite stressful and bring back some traumatic memories for some of our community. And so we wanted this place to feel like somewhere where they were just comfortable. We wanted it to feel like a big living room. And so we have a coffee bar in the lobby the smell of coffee often helps people relax and just makes them feel more welcome. They get to interact with each other a little bit. And just be here if they need somewhere to just be for the day or for a few hours, that there's somewhere inside they can charge their phones, they can see some of their relatives, they can interact with some of the staff, but just a place for them to be for a while. Mm-hmm.
So I would say the word that pops into my mind is inspired, because I walk into it, the design is inspired, all of the artwork hung around the building just makes it feel so much more welcoming in many ways. Can you tell us a little bit about, so what was it like before in the former clinic? What was that like?
Sure. So we were providing services in 3 different facilities. We had a separate dental facility, a separate medical clinic, and a separate behavioral health facility. And so they were in much older buildings, somewhat sterile environments, very outdated, and again, just had some of that kind of trauma feeling for some of our staff just based off of years of kind of inadequate service. And so our goal here was just to reduce those things and create this whole new place where people could come in and they might see the artwork of their relatives here, just be reminded of everything that's come into play here. We tried to incorporate lots of elements that are important in the community. Cedar, water, salmon, orca whale. So we have all of these features that are somewhat indirectly represented in some of the art and the design features within the building. And so you walk into this facility. The lobby was designed actually around our entrance piece, which is the whale rider. One of our elders who has passed on, Joe Ives, his art is featured throughout the lobby, and that is one of his main pieces. So we were fortunate enough for his family to still allow us to purchase those pieces and be able to showcase some of his work here. I think there's at least one piece of art in every space in this building, including individual offices. And really just trying to feature the local artists here of all different ages. We're working right now to bring in more pieces from women in the community, and so we've been reaching out to some of the women in the community to bring in some of those pieces as well. We have a pretty matriarchal community, and we want to make sure that's showcased as well.
I think I also heard previously that some of the artwork was done in collaboration, sort of more of an apprenticeship type of thing, where the elders were then sharing their craft with younger members of the tribe.
Yeah, we do. We have a few panel pieces that are featured. I think one is right outside this room in the lobby area, and a few panel pieces that were done in collaboration with an elder and a youth. And these youth are now grown adults, but it's very cool for their families and now their children to see those things as well. We have lots of signage around the main campus here too that is also done from projects like that, where there's been collaboration between youth and elders.
Very cool. I love that. It just makes it so welcoming. So I think if I say this correctly, that what I got the impression of is that really one of the inspirations was to create more of a whole person, or a whole kind of a person-centric type of care model, where it wasn't necessarily someone having to go for specific services, but that it came to them and you were treating them holistically. So could you talk a little bit about that?
Yeah, absolutely. So, health disparities in Native communities is historically high and remains historically high, even in our community. With the different locations between our facilities, it made it difficult to even make referrals between one department and another. Although those referrals were happening, sometimes patients didn't go from point A to point B to make that connection. So about 3 years ago, we started working with an integration team within our department, pulling together members from each area that's represented, each type of service, and really kind of just looking at what our workflows are individually and then working to combine them. And so for the last 3 years, we've been kind of practicing what that looks like when we move to a co-located facility. And so now we're actually getting to implement some of those things that we've been working so hard on. And instead of doing referrals, we're actually calling in the different provider types at those appointments to get people the service they need while they're here in the clinic. So if we're doing standardized screenings of all patients, if there's something that shows up on that screening that they may need behavioral health services involved, maybe they're struggling to manage a chronic illness, then we have our behavioral health staff that can come right in with the provider, and they can do a warm handoff, and the behavioral health provider can help them identify ways that maybe they could make some small behavior changes to help address those medical needs. And so we still meet weekly with our management staff about our workflows and how to improve our integration system, and then bi-weekly with the rest of our health services staff to just continue to improve that model. But essentially, we're being able to meet people wherever they're at, whichever access point they're coming in for. So if they're coming in maybe just for a substance use evaluation, maybe they also have unmet medical needs. That's not uncommon. Almost always unmet dental needs. And so we can bring these people right there, right to them, the providers right to the patient, rather than the patient going from space to space. So it's fabulous. I think we will really start to see the quality of care improve for our patients, and hope to see that in the next few years we'll really be able to show that some of these disparities are reducing significantly for our community.
You would think it, yeah, I would, if I were a patient coming in, you would think, I would think it's so much less stressful to have other folks that they're kind of the full complement of disciplines come to me, as opposed to, you're right, sort of me going out and seeking, because I would imagine there's often stigma still associated, whether it's substance abuse or behavioral health issues, or even some medical stuff at some level.
Sure. And in our design process, when people check in at the reception desk, we have one reception desk that people are checking in at, and they're all checked in the same. So a medical assistant or one of our CNAs is rooming them all the same. So if you're in the lobby, you don't know what anyone is there for. They're going to be brought back onto the exam side the same way as the person before them. And so nobody knows what you're there for until you're back behind those doors. And we have some beautiful consult rooms intermixed with our exam rooms. So you might see an exam room and then a consult room. And the consult rooms are not just used for behavioral health. Some of our providers also use those to meet with patients if that makes them feel more comfortable. And so, yeah, I think the design of the building is exactly what I had hoped for. We're still, we still have to work to break some of those habits that we've had and still breaking down some silos from, working in those very specific areas. But I think we're starting to see that our providers are really recognizing the benefit of one another and seeing how when they collaborate more, their patients benefit more, and it reduces their workload as well, because they're not struggling to help someone with a chronic illness when they have this other person there to assist with some of those other needs.
Great. So you did say that, the services were provided in different buildings before, but is there something that you're able to offer in this building, new building, compared to what you were able to do before?
Yeah, I think there's several things. We have a decontamination room here, isolation room, so we are able to see some patients who are really ill right now. Mostly, we're using that room mostly for COVID-related patients, and they can access that from the outside rather than coming through the clinic. So we can access from a different entrance point and get them directly into that room, and not worry about the airflow coming back into the rest of the clinic. We are adding more services. We have physical therapy starting in a couple of weeks, acupuncture, chiropractic, and massage therapy here. And in about a month, women's health. We'll be bringing back some specific women's health providers, and pretty eager to build some more formal partnerships with Multicare and a few of the other agencies in the area to bring in even more specialty services right here to the clinic.
Awesome. So how many staff do you actually employ that are your staff versus potentially contract staff? Because it sounds like you bring in some services as well.
Sure. We have a little over 50 full-time employees right now. We are adding about 5 staff before the new year, and we'll probably add a few more even come January. Because I think we have about 10 to 12 contractors. That ebbs and flows a little bit. My hope is to start out with contractors adding some of these extra services, but that eventually those will become employees of the department, so that we have some more flexibility and just more access to them. Like I said, we're very eager to build some new partnerships. I think our procedure room here can probably handle some same-day surgery type procedures if we get a provider in here that is able to do that. And so maybe, looking at our high rates of referrals for cardiologists, some of those areas that we refer a lot out to where our patients have a long wait time, working to get those providers here, even if it's once a month, so that we can make sure that follow through happens. I think those are our big goals, is really kind of looking at our high rates of referral services and then getting them in-house.
I would imagine that's probably one of the challenges, not only wait times, but just travel times too.
Yes.
And the difficulty that adds on.
Yes, so transportation is a difficulty for many of our patients, especially our elderly patients. We do provide as much as possible transportation assistance, but they often also need advocacy and someone, being a second ear kind of in the room to help them recall the information. And so being able to provide those services here also adds that dimension of collaboration with the providers, where they can get a direct collaboration, a direct conversation there going about that patient, so they know, what other care they might need.
I know that even with my own aging parents, that advocacy role was important to have another set of ears and eyes and to track that all. So what type of disciplines would you say that you have here? Social workers, nurses of all types, physicians, etc.
So we have 2 MDs, a physician assistant, an ARNP. We're adding a psychiatric ARNP right now. Several nurses, medical assistants. We have community health representatives too, which are tribal members who have gone through some training and certificates through Indian Health Service, kind of providing that advocacy role. A lot of times they're the ones helping with transportation. So we're up training them right now. They're working on rooming patients right now, and we're working on a CNA program for them so that we can build their skill set up and help get some more tribal members interested in the medical field at a higher level. So they're practicing that already in the new facility. We were able to have two of them assigned to the clinic to help room patients and make that coordination happen a little better. Lots of administrative staff, substance use counselors, mental health counselors. We're hiring another clinical social worker right now to help with the behavioral health consulting, filling that role.
So you mentioned a little bit sort of the training up opportunities or new opportunities for that training. And we're really in kind of a tight labor market, which I don't expect that to change much in the not too distant future. But have you also experienced difficulties in recruitment, especially for those credentialed positions?
We have. Fortunately, we don't have a lot of turnover in our department, so we haven't had too much of that. But as we're trying to grow, we're definitely feeling the constraints of that, and finding it pretty difficult to find providers to come in, which is why we've been outreaching to some of the other agencies. Oftentimes, because we're so rural, the psychiatric provider, for instance, that's been a very difficult role for us to fill for many years. And in the past, we've even partnered with Jefferson Health and shared a full-time provider. So, together we were able to come together and intrigue someone to come on full-time, and we split the time between us and them. And so we've had to be creative sometimes in how we fill those roles, but we have been successful in doing that in the past. So I'm hopeful that we start to see that change. The tribe offers excellent benefit package and daytime hours. So that's one of the draws that we have seen with medical staff, especially, is that those that are really struggling and working triple time at the local health facilities are happy to make a change for an 8 to 4:30 job with a nice benefit package. So
that's a little bit of a plug for recruitment. So check out your website, I would imagine, for opportunities. So going back to kind of that whole person care, and obviously there's this clinical component, behavioral health, et cetera, but what I also thought was really inspiring is the vision to kind of reincorporate, and I'm sure it was happening beforehand, but you now have space probably more to more effectively do it, is to reincorporate more of the traditional, whether it's plant-based, dietary type of thing, but the tradition back into the healthcare component.
Sure. I think that's reintroducing culture back into everything that we're doing, into every program or every service that we're offering here. I think that's critical. That's a critical piece for our community. With COVID and the amount of isolation that we've had over this past year, we've really seen the impacts of behavioral health on our community. We're a very close-knit community. We spend a lot of time together. So to be away from your family for long periods of time and not have, our ceremonies and gatherings the same as we like to have them, that makes it very difficult, especially for our older folks. But we've seen the impact on everyone in the community, and so incorporating culture, using plant medicines, teaching people how harvesting certain plants and the use of those plants, along different seasons, and being able to incorporate them back into the clinic was a huge goal for us. And so we are working with some tribal members to try and get some of our traditional medicines in our dispensary here at the clinic, and working to teach and educate the staff as far as what their uses might be, how long, shelf life, those things, so that we know they're not interacting in a bad way with anything that the patient might already be taking, but even helping people learn how to harvest them. We've done it in creative ways. We've had small groups go out and gather. We've used Zoom to teach them, make recordings about how it's used and what it's used for, and even given out kits so that they could do it at home while they're watching the Zoom live and be preparing these medications. So it's been, I think COVID has been a very difficult thing, but it also has brought some really unique ways of teaching people and reaching people. So yeah, we're excited about that. I'm hoping to use some of our spaces in the lobby area to put up some kind of campaigns or educational things about different types of medicines throughout the year. And so that we see some plants, for instance, can be harvested all year long, but their uses during each season might be very different. And so teaching the community, reteaching the community really the benefits of them throughout that part of the time of year, I think will be really, it's really neat for people to see them get inspired again and remember or learn the uses of them.
Exactly. It could bring back wonderful memories from one's childhood and sort of reincorporate that into it. And I think what I really loved going into the kitchen space where some of that training will happen, or some of those classes, I love the imagery on the walls, which actually sort of highlights the different plants, and it was just fun to read them because I had no idea.
Yes.
Right? It's just cool. I absolutely love that. So how many clients, I'm more used to sort of regular clinics. They have a certain panel or whatever they call it, where you have a certain number of clients you can serve. What is that caseload or the client load that you can handle in this facility?
Well, right now we serve about a little over 1,800 patients in our clinic throughout the different service types. We do expect that to increase. We have seen some increase. We are the only Indian health facility in Kitsap County. Okay. So we serve all enrolled members of any tribe, Port Gamble-Sklallam, and Port Gamble-Sklallam employees, and then non-members that are living on the reservation. So we have a pretty wide patient base. We do expect to expand some services. I don't know what that looks like exactly at this point, but we wanted to make sure we were solid in providing the service that we wanted, quality service here for our existing patients before we looked at opening up to even more. But for instance, we're a state licensed substance use facility, and so we see non-natives through that program, but they may not be eligible to get mental health here and may have a huge need for mental health. It provides a huge disconnect for that patient if we have to refer them out and then try and it just adds a whole nother barrier that we really don't want. So we may look at expanding to patients that we serve in one program and not others as kind of a starting point. And so including other departments within the tribe that might service them, like our early childhood facility sees a lot of low-income families, but they can't access health care here, but they're bringing their child here every day. And so looking at those opportunities, I think first to expand and make sure that we have the staffing to meet their needs and can still provide the same level of care. But I expect some growth in the next year or so.
Okay. So yeah, it's kind of another illustration of some of the silos you were talking about before, sort of those discipline silos, but it's also that access to care has its own set of silos.
It does, yes.
Yeah. So is there anything that you would like to share with our viewers of the program that, I didn't ask a particular question, but you want to make sure that they understand?
I'm still really in awe of this building. I got to be involved in the design process from the very beginning and had a very clear vision of how I intended service delivery to be in this facility. But I see this, I'm a tribal member here, and I see this as something that, isn't just I'm not just designing this for service delivery, but I feel like I'm designing this for my family. And this is, it's something I'm passionate about, and I think about it often. I spent many nights here during construction, just kind of looking around and making sure it was exactly right. I spent countless nights here getting the building set up, just making sure that everything was exactly the way that I had intended it to be, and trying to help staff understand that there wasn't anything done that wasn't intentional in this building. Everything was placed a certain way for a reason, and right down to the lighting and things in this building. And I think helping people understand the thought process behind some of it really helps them roll out the service delivery as well. But I have watched many of our patients come in awe of this building, you know, and to see the look on their face. And at our grand opening, I actually saw tears rolling down. And it's just a really great feeling to see that those are tears of joy instead of, we've already broken down that one barrier. You know, people are wanting to come in for service, and it's just very rewarding for me.
So from inspiration to opening, how long did that take?
Oh gosh, feels like it took forever. It took about 2 years, I would say. It actually wasn't that long of a process. We designed the concept of the building prior to even having any funding. It was a very, very quick time frame that we had to submit for our first grant application, which was to Indian Health Service. And we changed the concept plan, I would say pretty significantly, but the main concepts were still there. Mostly we changed size of the building and making sure that we weren't moving into this with it being outgrown already.
Right.
You know, making sure there was room for some growth for us. Square footage wise, this building is not much bigger than the 3 facilities together, but the space is utilized so much better and more efficiently that it makes a significant difference in what we're able to provide.
Was it a challenge to find an architect that would be able to take that vision of the space and bring it to fruition?
It was. We actually had a huge response, more than we expected from architects. So we received, I think, over 30 RFPs for our project, and it was very difficult to narrow that down. In the end, we settled on an architect team. One had healthcare experience, one had hospitality, and it was a perfect mix for what I was looking for this design, because I wanted this to feel, you know, very welcoming and comfortable. And so the 2 of them together were really able to merge those 2 things and really kind of give me what I was looking for.
So it's just a welcome home to the tribal members receiving care here. And oh, by the way, we get to take care of your whole person while you're in here.
Right.
So that's wonderful. Jolene, I have so appreciated the conversation and your willingness to invite us in to check out the healthcare center. It is truly inspiring space. I think your vision to creation is been fully realized, and with all the nights that you were spending in here on top of working on your PhD program and everything else that you've got going on, it came off so well. And I know we will have those health outcomes that you're looking for are only definitely going to go up as the disparities go down. So thank you so much, appreciate it. And thank you all for taking the time to watch the program today. I hope you learned a lot. We'll have some information on the closing slide for a website link where you might be able to get some more information. But hopefully you learned a lot, and I'll see you next time.